it is my pleasure to actually introduce Claire O'Connor. She's a registered nurse at Hamilton Health Sciences, where she started as an ER nurse, near and dear to my heart because I'm an emerge doc by night. And she has held a variety of positions over the last 15 years. Most recently, she's been working as a continuous quality improvement coach, so a CQI coach. And when her current mat leave ends, she's going to be going back to work as the manager of virtual care. So we're really excited to have her talents everywhere. And it's been really nice that she's been so generous in sharing those talents with all different groups. Claire has a master's degree in quality improvement and patient safety from University of Toronto and also holds a part-time appointment at the McMaster's School of Nursing. So Claire, I'm so delighted to be able to introduce you. It's my privilege to have known you almost for the entire time of those 15 years. That's, probably dating on me a little bit, but I'm, really excited to have you here and to talk about, is my quality improvement project likely to succeed and what to do about it? So I'm going to leave the stage to you.
Thank you so much. And yes, when we say it out loud that we've known each other for 15 years, that definitely makes me feel older than I think I should feel. But thank you so much for that introduction. So welcome, everybody. So yeah, as Teresa said, this talk is about how to sort of understand the factors that lead to your project being successful. And then if it looks like maybe it's not going to be successful, what you can actually do about it. So some concrete strategies. So just to start, in terms of conflict of interest, I have no conflicts to declare. I have no relationship with a for-profit or not-for-profit organization. As I mentioned, my employment is with Hamilton Health Sciences, and I am assistant clinical faculty at the School of Nursing. So the objectives for this session today are to understand the factors that lead to a QI project being more likely to succeed, to understand and apply two different models to make that assessment of your QI project, and then to identify some strategies that could increase the likelihood of your success or sustainability of your project. So as I was thinking about this, I don't know if people remember, this was like a viral video series from the BlendTech blender, and it was called Will It Blend? And they would put all sorts of wacky stuff in a blender. And I thought, that's how I feel about QI, like, will it work? Sometimes we obviously go into it thinking that it'll work, especially if it's an idea that you've crafted. We want to believe that it's going to work. But we don't always take the time up front to sort of do an assessment of whether or not this project is set up to work. So if only we had something like this that could help us. And I hope that by using these two models, we can sort of have a better understanding of what might help us predict success. Because we know that a large percentage of organizational change actually doesn't succeed or doesn't stick. So it's important to try to set ourselves up for success. So again, why is this important? There's multiple projects that we could be doing. I'm sure where you work, there's always things being prioritized and reprioritized, and because there's limited time and resources. So we really want to try to pick projects that have big impact, but also are likely to be successful. And there are simple things you can do. You can use an impact effort matrix, but they don't always, in my opinion, give the full picture of what goes into making a project successful or important. So there are frameworks and tools we can use to provide a bit more of an objective assessment. Okay, so again, as I was thinking about this, I thought about the BlendTech blender first, and then I sort of thought about seeds and soil. And so if you're thinking about a project that maybe was or wasn't successful, or trying to predict if your project will or will not be successful, is it about the seed? Is it about the idea itself? Or is it about the soil, the context in which the seed is planted? Or is it a combination of both? And so as I take you through these models, we'll revisit this metaphor and just see what these models suggest about what's more important, or sort of what the ratio of importance is. So the first model that I want to talk about is the model for understanding success in quality. So it has a neat acronym, it's MUSIC. And this model is from Heather Kaplan et al. It's from about 10 years ago. It was developed in combination with literature review and expert consensus. It does look a little bit busy, but I am going to take you through it step by step, and the color coding I find really helps. So this is a great model to sort of understand the context in which quality improvement is done. The authors of this article talked about how sometimes QI is criticized that, oh, it doesn't work in healthcare. Those tools, that's all for manufacturing. It doesn't work. You can see it didn't work that time. Your project didn't stick around. But the authors really wanted to dig into, maybe it's not just about the tools, maybe it's about the context in which the tools and the processes are applied. So basically they broke it down into kind of three big categories. So we'll start on the far right-hand side in green. So that's your microsystem. That is where your intervention is taking place. So maybe it's a unit or a clinic or in a practice group. and it has the individual leadership in that area and their QI acumen, the motivation and QI capability of the frontline staff, and the QI culture that exists there. And I think this is really important because the microsystem is different everywhere you go. And even if you have the same project, it can end up turning out differently in different areas. So as you can see, there's a lot of solid arrows, and those represent areas of influence. So we'll sort of move to the next in the yellow section in the middle. And that's your QI team. So in a large organization like the one I work at, there is a QI department. There's teams put together that has leadership from that department. It can also be clinical leaders in terms of like physician leaders that have QI that are part of the QI team. But this is sort of the people that have been formally trained and are here to help implement things in a microsystem. So some of the factors that are important there are the team leadership, the diversity of the team, the presence of subject matter experts. Then in the middle box, it's sort of how the team functions, the norms, the skills, and the decision-making process. And then just below, you can see physician involvement, prior QI experience, and team tenure also sort of feed into how the team operates. Then I'm going to skip over to the red section. We're going to leave the gray for a minute, and that's your organization. And as you can see, the organization is a bit removed. There's fewer arrows that interact with the microsystem and the QI team. That's where we talk about our QI leadership. So that's your executive sponsor of your project, sort of setting the QI culture for the organization and the QI maturity. And again, you can see that there are some solid arrows, but there's actually not a lot of interface right at the front line. And then quickly, I'm going to talk about the dashed line arrows. So this is where there wasn't consensus among the experts about whether or not there's influence. So looking at the furthest end is the external environment. So there wasn't a lot of consensus about how much the external environment actually impacts success. So if you were taking a project that was maybe a provincial priority, so something like what was formerly known as HQO, if it was something they were working on, that may or may not actually trickle down to the microsystem where the changes are taking place. It may have some relationship to the QI leadership, but that's typically where it might end. And then there's sort of this sort of black hole that's called a triggering event. And that sort of has bidirectional hashed arrows, because again, there wasn't consensus about the relationship. And I would kind of agree. I think that sometimes a triggering event can really mobilize people. So a triggering event would be something like, a catastrophic medication error, perhaps some sort of harm that happened that perhaps was leaked to the media or was very well known, that gets people really emotional and agitated and wanting things to change. Around site surgery is another example. So it has potential to mobilize and motivate people for improving the system, but that's not a guarantee that your project will necessarily work. And then the last thing I'm going to highlight as we sort of walk through this model is the gray box there, which is sort of your supporting functions. So the QI workforce focus, the resource availability, and the data infrastructure. Because we know QI, it's all about our data. We know getting data is a challenge. So the more data infrastructure we have, that potentially influences. Again, you can see the arrows just sort of go over to the QI team and a bit to the microsystem as a way of support. Okay, so again, it's still a bit big. It's very busy, lots of arrows. What's the bottom line for this? The microsystem and the QI team are both interdependent and mutually reinforcing. And what the authors came up with was that it's really those two systems that are more likely to predict the success of your project. And I think I mentioned this earlier, but if you roll out a big project, I think this is where you see the interplay between the QI team and microsystems. Is if you're rolling it out across multiple units or areas, you can go to one area with the same QI team and it just takes off and they get it and they're interested in it and it works. And then you can take the same thing and go to another microsystem and none of the strategies that you're using work because maybe there's different leadership, there's different culture, there's different motivations. And so that's why it's really important to sort of understand these as sort of living things. And it's not just a one size fits all. So it's really the QI team in the microsystem being able to cultivate the factors they talk about here is what is more likely to lead your team to, or to lead your project to be successful. It has some limitations. So this model is not going to be as applicable to a standalone setting. So like a clinic or a family health team, probably because your organization, your QI team, and your microsystem are all the same people. There's not different players. It is a subjective assessment of these individual factors. So I might say that, oh, the culture here for QI is really great in this microsystem. And someone else will say, no, it's not. It really isn't. So if you're trying to do an assessment, it's not going to give you like a concrete score. There is still a lot of room for subjectivity. And just building on what Tara talked about the importance of co-design, about the importance of involving patients from the start, there isn't anything in the model that talks about patient involvement and whether or not that leads to success. And again, this model's from about 10 years ago, so the settings was a little bit different. But I think now if it was ever updated, I would love to see what the impact of having patient involvement would be in terms of success. So in summary, according to this article, it's the context that tends to matter more to predict success of your project. And the microsystem and the QI team are of greatest influence. So in this one, we can see it's all about the soil. So what can you do to feed the soil according to this model? So in your microsystem, it could be things like team training to sort of shore up the QI capabilities and perhaps influence the culture. There's lots of free training. There's lots of training out there. Some are free, some are low cost. The IHI Open School comes to mind, or you can do some just-in-time training internally. In terms of your QI team, make sure you have a diverse team. Make sure you have people with different perspectives. Sometimes it's helpful to bring in someone that has just fresh eyes that isn't as familiar with the project. This model talks heavily about physician involvement being crucial to success, and of course, involving your subject matter experts. And then organizationally, being able to articulate or outline how your project supports organizational strategy and or aligns with external priorities can be helpful if you need to shore up your organizational support. So that was the music model. And now I'm going to move into the NHS Sustainability Model. And this one is really great as well. It's great for different reasons. So it's a 10-factor model that takes you through questions about the process. So that's all the categories in green. There's the red, which talks about the staff, and then there's the blue, which is the organization. This model I like because it's actually, there are scores that are generated, so it is a bit more objective. And this is for analyzing a specific project. It's not for assessing the organization as a whole, whereas the music model, you could kind of look at it as assessing the whole organization to see what the context is there. There's a few ways to use this. I think the most obvious one is use it together as a team, as a QI team, and you can use it as multiple points throughout your project, and that's actually what they recommend is the beginning, maybe the middle of your project, and maybe towards the end. I think the more interesting way and maybe the more higher yield way to use it is to use it individually, but at different levels of the project. So I would ask the executive sponsor to fill out the questions and rate the project according to these factors. So that would be somebody who's knowledgeable about the project, but not necessarily doing the work. So I'd ask them to do it. It's only 10 questions. It doesn't take long. Then I would have this QI team leader do it. And then I would have somebody from the microsystem front line have them fill it out. And then you can actually compare the results and you can see where there's alignment even within your own project implementation team. So that can be kind of interesting because you can get a lot more insights that way. So I'm not going to go through the entire model, but I thought it's important to show you a visual of what it looks like. It is available online. It's completely free. And I think there is actually an Excel version where you can input your answers and it will calculate it for you. So the first one in the process, again, I think there's about 4 or 5 questions, but we'll just look at what 2 of them are, is benefits beyond helping patients. So I like this because it actually gets you to rate the quality or the feasibility of your actual change idea, whereas the music model doesn't really dig into the individual change idea. So this is about, will staff notice a difference in their daily working lives? Does this make things run more smoothly? Does it reduce waste or avoid duplication? And of course, does it help patients? And then credibility of the benefits. So are the benefits to patient, staff, the organization visible? Do staff believe in the benefits? Can staff clearly describe the full range of benefits? And is there evidence that this has been achieved elsewhere? So you can see that there's sort of 4 categories for each, and you would go through and you would rate them that way. The other nice thing about this model is all the factors are weighted, so they're not all equal. So some of them are going to be more important to shore up or to get right, whereas other ones are not weighted as heavily. When we look at an example of what some of the staff questions are like, are staff involved in the training to sustain the process? So are they involved right from the start? Do they have a say? Have you used any of their ideas? And what are the staff behaviors towards sustaining the change? So are they encouraged to be able to express their ideas? Do they think this is a better way of doing things? Are they trained and empowered themselves to run PDSA cycles based on their ideas? And again, I think this is where the interplay between having 3 different levels fill this out individually can help you see maybe where some of the gaps are. And finally, organization. Again, this is just an example of the questions. Are the goals of this change clear and shared? Are they communicated? Are they contributing to the overall organizational strategic aims? Is this change idea important to the leadership, et cetera, et cetera. And then this one is the infrastructure, the last one. So it's important to remember that they recommend doing this multiple times because you're not going to have everything finished now. So when you're starting out, you're not going to have the policies and procedures in place because you're not at that stage. You're still refining and testing out your ideas. So it is normal to score low on some of these more long-term looking factors because you wouldn't be able to have this at first. But it does highlight to you that you do need to think about, what is it going to be the communication system? How are we going to operationalize this in terms of policies and procedures to support the new way of working? So after you've scored it, it can display the data 2 ways. I just showed it in the bar graph. And this is a fictional project that they scored. So the colored lines are the maximum score in each category, and the grayed line is what this fictional project would have scored. So as you can see, again, the categories are weighted. They've given the highest weighting, you can see, to credibility of the evidence and senior leadership engagement. And the other ones sort of fall around the 4 to 6 in terms of the score. So this is a great opportunity to see, wow, where is my project falling short of where it could be? And you would expect that at the beginning, especially, there will be maybe 2, maybe 3 areas where you need to dig into a little bit more and see what you can do to either make it seem like the evidence is more credible, or what your change ideas about selling the project to frontline staff about the benefits to doing it, and where you need your clinical leadership engagement or your senior leadership engagement. That is what the model looks like. I have used it on multiple projects myself. I find it extremely user-friendly. It does come with a whole guide as well. Again, it's all free and it's available online. Some of the limitations are novel ideas, which likely don't have any evidence yet. They may score poorly. That's not an indication you shouldn't go forward with this. The score itself isn't like a stop-go thing. You don't have to have a certain score in order to continue with your project. It is just sort of diagnostic. It is developed to assess interventions for patients. It is not developed for staff projects that would improve their work life. And we know now with the quadruple aim that staff work life is an important part of quality improvement. So this model wasn't set up to assess those projects. You could probably adapt it yourself, but that's just, they put that right in the guide. So in summary, the NHS Sustainability Model, it is a diagnostic tool. It has concrete weighted scores. It can be used at any point in a QI project. I would say the biggest impact is before starting, because you want to start any project with the end in mind about how it's going to be sustained. And I also like it because it considers both the intervention and the context. So I'd say it's about 70% the context, the soil, and about 30% the seed or the idea. So looking at those 2 models, and thinking about our plant metaphor, most of it is about feeding the soil and not the plant. That's sort of the takeaway point for me when I have reviewed these. But I do also, I'll put an asterisk that I do think it's important to pick a reasonable seed as well. You do want to be able to communicate the benefits beyond helping patients, the benefits to staff. You want to be able to articulate what the credible evidence is about why we're doing this change. So just some takeaways for what you can actually do if you use these models and find that your soil is perhaps lacking. And I would recommend you can use both of these models. I do think they really interplay well together, and I think they sort of add additional layers to your project. So have your frontline staff or teams involved from the start. That's explicitly stated in the NHS one, and I think it's implied when you think about the QI culture in the microsystem in the music model. QI training for staff, you want them to be able to take the reins and run some small tests of change, or at least have some knowledge about why we're doing changes the way we are and how we're monitoring them. In terms of organizational support, you want to be able to clearly articulate a connection between your change ideas and the organization's goals. And then articulate the evidence for change idea, the what's in it for me, especially for the frontline staff. So being able to clearly state that again, because that will help with microsystem and having that team on board. Ensure you have diversity on your team. So that could be different disciplines. That could be people that have subject matter expertise. That could be people that don't have subject matter expertise and are bringing just a fresh lens to it, because that can be valuable as well. And you want to plan from the start about how you're going to monitor and sustain your change. Also, don't forget, QI is also about learning from failure. Failure is not something to be feared. We actually had an abstract category for this conference that was about send us your project that failed, that just crashed and burned, but tell us what you learned about it. So there is nothing wrong if your project doesn't work. We had a consultant come to our organization. It's been a while since I've seen her, but she would say, it's not plan, do, study, run away. It's plan, do, study, act. And so even if it doesn't work out, you act on it and you adapt and you change. You can publish a negative result. Like I mentioned, we were looking as well to accept abstracts that had negative results. And you can use these tools even retrospectively to try to understand what the barriers may have been to a project that wasn't successful, especially if it's something that might be resurrected later on. So you can see what you can tweak and what you can work on to make it more likely to be successful in the future. So those are the references for the two models. Again, they're available online. We can make it available on the website later if people are interested. And with that, that is my content. And I'm happy to do some Q&A if people have questions. That's what I have. So hopefully that was helpful. Hopefully that was useful. And hopefully you have some takeaways about what you can do differently in the future.